Welcome to Clyde Ellis Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Peter Winkelstein, Vice President and Chief Medical Information Officer at Kaleida Health. In this episode, we'll be discussing the electronic medical record and a large project taking place that impacts many providers and their patients here in Western New York. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Winkelstein. Thanks for joining us today.
Thank you for having me.
So if we can start at the beginning, electronic medical record, or what you refer to, it's moving to electronic health record. Tell us a little bit about what that is and what that means.
So the electronic health record is basically the medical chart in electronic form. So it's what used to be paper charts. Probably some of the younger members of the audience have never seen a paper chart.
Sure.
But all that information is now stored electronically on the computer, where it's much easier to access, much easier to find the information, much easier to organize the information.
Right. So you'll see computers kind of on wheels in the inpatient units, or if a physician office, they might be on their laptops. That's what you're referring to?
Exactly. And you'll see computers all over the place. Sometimes they're on wheels, as you point out, as they move around on the inpatient units. Sometimes they're on desks. Some people have tablets. Some people have laptops. It depends on the circumstance, and it depends on the individual.
Sure. So Kaleida Health and their partners, ECMC and the university, made some news recently with their announcement of their major investment. Catholic health system, others are investing hundreds of millions of dollars, not just here in Western New York, but across the country. Why is it so significant? Why are those types of resources being spent right now?
So it's generally recognized across the nation, really across the world, that having good information is the foundation for good decision making. And that's certainly true in medicine, it's true in all industries. And when we're talking about information for good clinical decision making, we're talking about the electronic health record. So the question is, how do we gather, collect, display that information in the optimal way, in a way that most supports our ability to provide great clinical care?
Sure.
And electronic health records continue to get better. The people who make the electronic health records learn how to make them better. And what we need to make sure that we do is we keep up and that we are right at the forefront of having the best technology. So that's the genesis of putting a fair amount of investment into our electronic health records. We're doing this in two ways, I would say. The way I think about it from a clinical standpoint, we do it in two ways. We're trying to take what we have and make it better.
Sure.
And then we're trying to take what we have and expand it, extend it to those members of our family that don't yet have this particular quality electronic health record.
So talk a little bit more about the family, or who it's being expanded to, or the connectivity. So it's been referred to in the physician community or in the IT world as the Glimmer project. What does Glimmer stand for, and what does that mean?
Glimmer stands for Great Lakes Integrated Medical Record. That's our internal brand name, if you will,
Sure.
for our electronic health record. The electronic health record is manufactured by a company called Cerner, and our implementation of it we call Glimmer. So we're trying to, as I said, take Glimmer and make it better for those people that are currently using it, but we also want to make Glimmer available to our partners, and our partners are those members of Great Lakes Health, including GPPC, the university practice plans, ECMC practice plans, and extend from there.
So I'm a physician. Why that works out in the community, the eight or 10 counties of Western New York. Why is that important? And if I'm a patient in some area of Western New York, why is that important?
If you're a patient and you come to a Great Lakes Health facility, and that facility is on Glimmer, which is our goal, then your information is all there. It's there. And it will be there when you go to the next physician who's part of Great Lakes Health and who's on Glimmer. So you don't have to worry about carrying a disk or carrying a chart or carrying a thumb drive from place to place, or repeating yourself over and over. You're going to always have to do some of that,
Sure.
But repeating yourself over and over again. That information is going to be there, and it will be following you as you go from office to office, or if necessary, onto the inpatient floors.
So we talked a little bit about expanding it out into the community, and a lot of it is, the technology push is being driven by technology in our lives everywhere, smartphones
Absolutely.
and banking and all the other industries that are facing this. So why is it's so important for us to accept that technology is not only into healthcare, but it's actually driving healthcare right now?
Well, again, it's not so much about the technology. The technology is the tool. It's about the information. It's about your physician knowing what they need to know about you. It's about your nurse knowing what they need to know about you if you're a patient.
Sure.
And how do you get the information that they need to them in an organized, timely fashion? That's where the technology comes in, and that's the electronic health record and other related technology. So it's really about the information. There is no other way to handle the quantity of information that's necessary for good clinical decision making without the use of the technology.
Sure. So this project must be massive from the sense of, you just think of one hospital or one health system, not to mention the university and the practice plans and the community physician. So how do you tackle a project of that size and scope?
It's an enormous project. Everyone who's involved in touching, looking at, entering patient information is going to be involved in this project, because that's where the information is. They've either got to put it in, they've got to look at it, they've got to do both, they've got to act on it. Anytime that you're talking about someone who's involved in patient information, they're going to be touched by this project. So you're right, it basically touches everybody.
Sure.
That means we need to be very good about explaining why we're doing it. We need to be very good about communicating what's going on, when it's going on, what's going to happen. And we have to be really good at educating. We have to train. How do you use this tool?
Right.
It's easy for me to say, we're going to make the tool better. The real question is, okay, show me how to use it better.
Right.
How do we do that? How do we get the training out? So why are we doing it? Communicating about why we're doing it, educating around why we're doing it, and then making sure there's ongoing follow-up so that if you don't remember, or something new comes up, or you've got a question, or something doesn't work,
Sure.
we're there to help.
Sure. So last question would be around technology and in impacting the physician, but also how they interface with their patient. How do you make sure that this invasion of technology that's already here doesn't interrupt that patient to physician discussion or contact or connection? So how do you guys ensure that as you go through this project?
Right, and that's a very important consideration. What we want is the technology to enhance the connection between the provider, the nurse, the doctor, the nurse practitioner, whoever is working with the patient. We want to enhance the communication and the contact between them and the patient. We don't want the technology to get in the way. We want the technology to facilitate that.
Sure.
So that's hard.
Sure.
That's a challenge. And we have to be very sensitive to the amount of time it takes for people to be using the technology. We want to make sure that we don't want time taken away from the patient because they've got to use the technology. We have to think about placement. Where's the right place in a room for a computer? That's what we get into.
Sure.
Should it be on wheels? Should it be on the desktop? Should it be a tablet? Because we don't want it here, right? Okay, so where do we put it so that it's in the best, so that it doesn't interfere with that patient relationship? And then we need to design it carefully so that the people who are using it and putting information into it are doing what they need to do and not a whole lot more. They're not spending a million times clicking for very little value. Sure. And that's on us to make sure we design that carefully.
Sure. Dr. Winkelstein, thanks for joining us today. Congratulations on what you've accomplished thus far with the project, and best of luck as you guys move forward.
Thank you.
Thank you. I'm Mike Hughes. We'll see you next time on Medically Speaking.